Welcome to the Care Planning Essentials Seminar. We'll explore practical ways to organize care information, from documents and communication to emergency planning. Please note this session offers educational strategies, not professional medical or legal advice, to help you build a portable care plan for home, assisted living, or other care settings. Today's objectives are focused on action. You will learn to build a foundational care plan, organize vital details, coordinate your care team, and prepare for transitions. Our goal is not perfection, but to make your next care decision safer and easier for your loved one. So what is a care plan? It is simply a written roadmap that ensures the right people have the right information at the right time. Whether it's a binder or a digital file, it converts scattered details into a usable checklist for everyday routines and emergencies alike. Why does planning matter? Without a plan, critical information is often trapped in one person's head, leading to confusion and stress when urgent needs arise. A structured plan clarifies roles and keeps documents accessible, significantly reducing chaos during medical transitions. Care planning is a universal readiness tool. It benefits anyone needing support, including aging parents, individuals with disabilities, or facility residents. It helps families, spouses, and caregivers stay aligned, ensuring that care remains consistent regardless of the person's age or specific diagnosis. A strong plan must be portable. As a person moves between home, a doctor's office, or a rehabilitation facility, information gaps can create risk. Never assume a new setting has your records. Always bring your plan with you and keep it updated after any significant change. To avoid feeling overwhelmed, follow this 6-part framework. It covers everything from your personal profile and daily support needs to medical snapshots, legal documents, emergency plans, and communication processes. If you're not sure where to start, begin with emergency critical information, contacts, meds, and decision authority. For your setup, I recommend a hybrid approach. Use a paper binder for easy access during appointments and a digital folder for sharing and updates. Whatever format you choose, include a one-page summary at the front, date all worksheets, and always keep your sensitive information secure. Section 1 is the personal profile. Start here, with the person rather than the paperwork. Include their preferred name, communication style, daily routines, and what makes them feel respected and safe. This human element is vital for providing dignified care in any setting. Section 2 documents your activities of daily living. Don't just list needs. Describe the level of support required, from queuing to hands-on assistance. The goal is to write these steps clearly enough that a backup caregiver could step in and follow them without guessing. Daily routines and preferences are key to consistency. By recording meals, sleep schedules, and even calming strategies, you help preserve the person's identity and choices. When systems become unfamiliar, this information acts as an anchor for comfort and dignity. Section 3 is your medical snapshot. This one-page health summary should be concise enough for emergency staff or new providers to grasp quickly. Include current diagnoses, medications, and contact information for your doctors. Remember to update this frequently, as outdated medical information can pose safety risks. Medication management requires strict accuracy. Your record should include the generic and brand names, the dose, the purpose, and the prescribing physician. Safety is your top priority. Update this list immediately after any change and bring it to every single medical visit. Care coordination improves when you avoid treating appointments as isolated events. Maintain a directory of your care team, track referrals, and keep notes on what was decided. After each appointment, ask yourself, what changed, who is responsible for the next step, and what is due next. Finally, Section 4 covers legal documents and decision authority. Know who can receive information and who is authorized to make decisions. Keep these documents signed, accessible, and current. Because legal requirements vary, always consult with a qualified professional to ensure your documents are prepared correctly. Benefits and insurance information are critical, especially during transitions like facility admissions or equipment setup. Document your coverage and key contacts clearly, but practice privacy. You don't need full account numbers in a shared binder, just the reference information necessary to get help when it matters most. Section 5 covers emergency preparedness. It is vital to plan for disruptions, whether they are major disasters or simple caregiver absences. A backup plan is not a sign of failure. It is a safety measure that protects both the person you care for and the caregiver. Your emergency binder is your grab-and-go solution. In a crisis, time is limited. Keep an emergency summary at the very front. If it takes longer than 2 minutes to read, it's too complex for an emergency. Review and update these pages on a regular schedule. A backup caregiver plan identifies who can step in for routine help or urgent needs. Just listing a name is not enough. Confirm their availability, ensure they know how to access your home or equipment, and practice the handoff. Knowing the limits of your backup support prevents confusion. Safety begins with your physical environment and equipment. Document mobility aids, supplies, and potential home hazards. When writing instructions for equipment, assume the reader has never used it before. Clear, written guides help keep care safe even when someone new is assisting. Section 6 introduces the communication plan. Avoid communication breakdowns by deciding early on how information will be shared. Who needs routine updates versus urgent ones? Determine which methods you will use and keep a written log of decisions to ensure everyone stays on the same page. Preventing family conflict often starts with clarity. When roles are defined and limits are respected, stress levels decrease. Use written agreements to clarify who handles which tasks, and if you find yourself stuck, don't hesitate to bring in neutral professionals to facilitate decisions. A care log is a simple yet powerful tool to ensure decisions do not disappear. It doesn't need to be perfect. It just needs to be factual and current enough for the next caregiver. Use it to track changes after appointments or health incidents. Transitions between home, hospitals, and rehab settings are high-risk moments for information loss. Every time you move between care settings, conduct a plan review. Verify medication lists and discharge instructions before leaving so you are fully prepared for the next phase of care. Use this hospital-to-home checklist to advocate for yourself. Don't feel rushed during discharge. Before you leave, confirm you have all necessary medication updates, follow-up appointment details, and clear instructions on warning signs to watch for once you return home. When a loved one moves to an assisted living or nursing facility, your care plan becomes a partnership tool. Use it to share personal routines and preferences with the staff. Your family-provided information helps the staff see the person behind the medical chart, improving the quality of care. Choose the right tools for your specific situation, whether that's a shared calendar, a secure digital folder, or a simple notebook. The best tool is the one your team will actually use and keep updated. Always verify privacy and security before sharing sensitive information. Here is your 30-day action plan. Don't worry about finishing everything today. Choose one small step, like updating your emergency contact list or your medication record. Momentum is far more important than achieving total completion all at once. To summarize, the key is to plan before a crisis hits. Keep your information current, ensure your plan is portable across all care settings, define roles clearly, and always remember to center the person at the heart of your plan. You can do this, one step at a time. We are now moving into our discussion portion. What information would your team need if you were unavailable tomorrow? Which section of your plan feels most important to finish first? Thank you for participating in today's video and for your commitment to better care planning. This concludes our core presentation, and we are now moving to the appendix portion of our video. These pages contain printable templates and worksheets designed for your immediate use. You can export these slides as a PDF or copy them into a personal handout to begin organizing your own care plan. First, we have our Quick Start checklist. Use this as the very first page of your care binder. If your time is limited, prioritize the first 2 items on this list to ensure you have a baseline of essential information ready for any urgent situation. Next is the personal profile template. This goes beyond medical tasks to capture the individual's identity, daily preferences, and what helps them feel respected. Using this helps caregivers provide truly person-centered support. The medical snapshot is your one-page summary. This is vital for appointments and emergencies. We recommend printing multiple copies and dating each one so that providers always have the most current information available to them. For your medication list, use this dedicated table. Please remember to review these entries with your healthcare provider or pharmacist regularly. While this worksheet ensures accuracy, it is a tool to support, not replace, professional clinical guidance. The ADL and IADL support worksheet helps clarify exactly what kind of assistance is needed. Use this to record specific needs for mobility, transfers, diet, and medication management so that backup caregivers can step in with confidence and clarity. Your emergency care information sheet should be placed near the front of your binder. Aim to make this document readable in under 2 minutes. It shouldn't be your entire record, but rather a guide that points people to the most critical information quickly. Next, use the Care Team Contact Directory. Keeping names, roles, and preferred contact methods in one place saves significant time. and reduces confusion about who should be notified when specific issues arise. The transition planning checklist is for those moments when care settings change, such as a move or hospital discharge. Use this before these changes occur to help reduce the risk of information loss during handoffs. The communication and decision log is a practical tool for keeping entries short and factual. You can maintain this in your binder or as a shared document to track what happened, what changed, and what needs to happen next. We wrap up the workbook with a 30-day action plan. Use this as your closing commitment. You don't have to do it all at once. Choose one specific task, assign responsibility, and set a due date for completion. This page provides starting points for Mercer County and New Jersey resources. These agencies offer community navigation, counseling, and caregiving support. Please verify eligibility and program requirements directly with these providers, as information may change. These notes are for organizers and presenters. Remember, this seminar is educational and does not provide professional, legal, or medical advice. Please ensure all resource links and event-specific details are verified before public distribution of these materials. Thank you for joining us for this video on Care Planning Essentials. We hope these tools empower you to improve care outcomes one step at a time. For more information, please visit our website at colorfuldreams.org or scan the QR code on your screen.